I'm Dr. Rosie Ndlovu. I'm the Managing Director and the founder of Innovo Mobile Health.
My name is Desmond Dube and I'm part of business development here at Innovo.
My name is Chantal Jacobs. I am the Office Manager for Innovo Mobile Healthcare and also the Project Coordinator for our Kuruman project.
My name is Corey Kutsia and I'm proud to be the Operations Manager of Innovo, the best place to work for.
It's been a couple of amazing months. It's been pretty awesome, but yeah, it's been a couple of months.
I've been with Innovo for just over a year now and absolutely loving it.
I'm approximately 7 years with Innovo and I enjoy the journey.
Well, it began about 6-7 years ago when we started and founded a company that we believed could make a difference in healthcare. The idea was to find an alternative that could provide quality services, and in particular for people that live in remote and rural areas and couldn't access healthcare facilities, I guess, that we access readily and easily in the urban areas. Earliest memories, I guess, when our first mobile unit arrived from the UK, and it was quite a fulfilling feeling, I suppose. And also it was really encouraging when we were doing the early exhibitions and showing what our mobile clinics looked like, because most of the experience with mobile in South Africa had been with much smaller mobile units that really couldn't provide a comprehensive service like we do.
So I started out at Innovo as a consultant, so sat down with Dr. Rosie, helped on some stuff. So one day we had a meeting that was supposed to last an hour, just a quick a meeting just to brush up on a few things. The meeting lasted about 4.5 hours, and the bulk of the meeting was her telling me about all the possibilities and opportunities. So then at the end of the meeting, she's like, so what do you think about working for us? And I told her, let me go home and think about it. Took me about 5 minutes to get home, then I was like, yeah, I'm in.
My earliest memory would be when we were sitting in a strat meeting as Innovo, planning and prepping for the year ahead, and just really being able to capture Dr. Rosie's dream. It was obviously a very business-minded approach, but being able to just catch her vision and her desires to just improve healthcare and accessibility to healthcare for people in this country, it was a real goosebump moment for me. And I actually realized for the first time that I'd actually joined a company where we were really making a difference in people's lives, and not just pencil pushers or doing a job for the sake of doing it, but we were really changing people's lives for the better. It was the first time I actually caught a glimpse of what Innovo is all about.
I think the challenging part of what we do is getting people to understand mobile is not a lower quality solution, and that it can provide a platform to deliver healthcare of the same quality that you'd find in any urban setting. We often think of mobile as, solutions for the poor, but they're actually not. If we look at the first world mobile clinics are used readily as a solution to ensure that we cover populations in all parts of the country. And we're hoping that we can do the same in South Africa.
The people we help are really the indigent of the community. So it's people who need healthcare but don't have access to it. So it's someone who is surviving off a grant, doesn't have the money to get to hospital. So it's one of those things that person is, I'm sick and I know something's wrong, but I don't have the money to access healthcare, so I'll just sit here and because there's nothing else I can do. So it's that life-saving initiative that we're basically bringing to them. Because you're getting there guys who are getting treated for things like cervical cancer, there's guys who are getting their HIV treatment. So if the guys didn't get that help, life wouldn't be a very long life for them after that. So we've got families that are not losing breadwinners because of what we are able to do. We've got communities that are thriving because of what we're able to do. Of course, through the work of our sponsors, but also through what Innovo does, an innovative way of delivering healthcare to the people who need it.
Every auntie and gogo and whoever in the community came to me and actually asked, when are you coming back? We need ABC procedures done, so and so in my family needs medical attention, etc., etc. So being able to assess the need was incredibly tangible, and watching the people's expressions and their overall just emotional reaction to the actual mobile and it's moving away from them was so heart-wrenching. And what triggered me the most probably was the little kids. We were next to a nursery school, and watching how they ran literally from side to side, watching every aspect of our move, and just knowing that those kids were waiting for us to come back to them so that they could come and see the eye doctor or the ear doctor or whatever the case it may be that they needed.
In the villages and the rural areas, there are no clinics at hospitals, they're not close by any hospitals, so we take the service to them. In the past, they used donkey cars, they used taxis to get wherever they need to be, and they had to pay for it. Now we take the service to them. And they're very happy, they get it free of charge, they get the medicine, and they can't wait for the next visit.
The communities in which we work, we have to be able to make a difference in those communities. And so we encourage companies and corporates in those rural communities, be they mining communities, be they agricultural communities, be they manufacturing communities. We encourage those corporates to give back to those communities by getting involved, and they can do that by partnering with us, so we can provide the service to more of those communities out there in South Africa.
We are making a difference, one mobile clinic at a time. We need partners to increase our reach and compound our impact. Get involved, share our page.